Hello everyone, my name is Anmol and I'm presenting on topic type 1 diabetes on behalf of my group members named Mandeep Kaur Chahal and Abhijit Singh. Starting with the introduction, type 1 diabetes are also called as diabetes mellitus. This is an autoimmune disease occurred due to the body's inability to produce insulin, which is essential to synthesize glucose from the food and to monitor blood sugar levels. It happens due to destruction of pancreatic cells, which are insulin producing cells, and regulates the absorption of glucose into cells. Next to the symptoms, what kind of symptoms can be noticed in child when it occurs? The main symptoms are thirst level begins to increase than ever, more frequent urination, high level of hungers and sudden binging, unprecedented weight loss and exhaustion. Another symptom is loss of clear insight or vision and becomes blurry. Next is what are the side effects on young children with diabetics type 1. The main side effects are retarded puberty or delay in puberty. This is the main side effect of having a type 1 diabetes in young children. It means failure to manifest initial feature of sexual maturation by an age that is more than 2 standard deviation above the mean for the populace. For example, in girls, menarche after 16 years of age, or beard development delayed in the boys. Next is what factors responsible for these side effects. There are few factors responsible for these side effects, and those are poor glycemic index rise. Poor glycemic index, it means rise in blood sugar and food gets slowly absorbed and decreases starvation levels. Other diseases associated with these issues are autoimmune thyroid disease, celiac disease, autoimmune gastritis, pernicious anemia, and vitiligo. Next is, if a person is suffering from this, what are the factors that should be considered while making a realistic diet plan? The first thing is period of plan. It means that at what person is getting this plan, their behavior, their body nature factors must be considered while designing a diet chart. Another thing is monitoring. Regular monitoring of blood sugar helps to meet out the right target levels and help to make decisions in order to get optimum sugar pace. It helps to maintain activity and enables the patient to enjoy the life fullest. So regular monitoring of sugar level is must. Next is taking medications. If a person is suffering from diabetes, medicine can control it to a great level. So right medications must be given on the while a person is suffering from diabetes. There are certain pills like insulin, pills to lower sugar level, aspirin, remedies like BP medication, cholesterol controlling tablets are good to combat with the risk. Another is reducing risk. Better understanding and proper knowledge of diabetes can help reduce the chances of major complications. So good knowledge about the diabetics and their factors should be given to a patient while they come for the checkup. Next is healthy eating. This is the basic that a person should choose the healthy choices of food so that they can have a good nutrition amount, so low fat dairy or low saturated fat food should be chosen. Another is trans fats are good to make proper control over diabetes, so trans fat food should be considered. Next is nutritional assessments. How above factors given to the nutritional education diet plan, it can help to monitor. It helps to control blood glucose levels, read out optimal metabolic control, self-care behaviors, minimize glycemia, avoid tissue damage and other complications, and confident lifestyle, optimal quality of life. What is the professional expertise assistance if a person is suffering from diabetes? To provide them effective healthcare methods, more than one expert person should be involved. I believe a nutrition manager talks with a patient doctor, they will be able to suggest much better foods according to the health. Next is showing up whenever patient needs you. This will provide a better level of satisfaction and hope of getting better to the patient. Another thing is continuously updating any changes in data so that if a healthcare worker knows the current every healthcare worker knows the current situation of every person and so that they can treat accordingly. Next is importance of follow-up before and after the patient discharge. It means that what things should be done before and after discharge of the patient. The things are to check whether the care plan is followed by the patient properly after their discharge from the hospital, otherwise they will not have a speedy recovery. To make sure that results of the treatment are favorable for the patient's speedy recovery. It should not take a much longer time for the recovery. Another thing is updating the dietary plans according to the improvement in the patient. Next is motivating the patient so that they can have and motivate them to follow a strict diet and consider rejection so that they can recover speedily and well. Another thing is principles of customer service. What are the principles should be considered during the course of healthcare for the speedy recovery? First is service. It is important aspect of caregivers as the most important aspect of professional care. Honesty. It is the duty of healthcare professionals to be true to their clients' patient in terms of diagnostic and treatment. Next thing is mentality. The way of treating patients with positive attitude can be beneficial for the patient as it gives them a positive vibes of getting better soon. Another thing is ethics. It is important for caregivers to have morality towards their client in order to maintain integrity. Respect. It is the responsibility of healthcare professionals to respect their clients during the course of their treatment so that they can feel valued. And these are some principles of the customer service. And if you need any information regarding these topics and more elaboration, you can follow these links and you can have more information. Thank you so much.